You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein. Today's show is on smile makeovers. We're fortunate to have in studio one of Arizona's top cosmetic dentists. So if you're unhappy with your smile, self-conscious about your look, or would just like to improve yourself, this is for you. Stick around, we'll be right back.
Welcome to an educational and comprehensive discussion with one of today's medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
In studio today, we have Dr. Paul Gebhart. Dr. Gebhart graduated from Northwestern University Dental School, where he was asked, because of his exceptional talents, to stay and join the faculty. Eventually moving on to open several advanced dental facilities where he is making over smiles and changing lives. Dr. Gebhart, welcome to the show.
Thank you very much, Mike. I appreciate it.
Before we get into today's topic about veneers, tell me a little bit about yourself.
Well, Mike, I grew up in the Midwest, went to dental school in Chicago, where I taught in the faculty at Northwestern for a little while, and then I moved on to open up several different dental offices in the Midwest. Got tired of shoveling snow every year and decided to move out here to Arizona and set up a wonderful dental office.
Let's start with what's new in veneers. Last 15, 20 years, what advancements have been made?
Oh my goodness, there's been so many different advancements. We've got better materials, better bonding agents to bond the veneers to the teeth, much better laboratories able to make things that look so realistic you wouldn't know that they were veneers.
What are some of the common misconceptions about veneers?
One of the major misconceptions is they're not for everybody. You know, everybody can afford veneers. They're not nearly as expensive as everybody might think that they are. We can change so many things in somebody's life with porcelain veneers.
Now, I know that you had, and you mentioned to me prior, that you've actually had veneers put in. I mean, I would never know it looking at you.
Yeah, when I was, probably about 12, 13 years ago, I had one of my instructors when I was in dental school actually made a wonderful change in my life by offering to do some porcelain veneers for me. I had grown up all my life. I had orthodontics, braces to straighten some of my teeth, but the shape of my teeth just wasn't right. The coloration of my teeth was splotchy and brown and white spots. I just was never happy with them. And then when she offered to do this for me, it really made a huge difference in my life.
So you had them done 10 or 12 years ago. How long do they normally last?
Well, I would say if you take good care of them, they'll last plenty of times past 20 years. Mine were done 12, 13 years ago with materials and equipment and laboratory technique that is 12, 13 years old. Right. Since that time, the bonding agents have gotten much better. The porcelain that we're using is so much better.
Now, does everybody use basically the same bonding agents and the same porcelain? Does all the dentists do it about the same?
Oh, no, definitely not. There's still the same bonding agents out there that were used on my teeth 12 years ago that are still being manufactured and used by dentists all over the country. If you don't stay on the cutting edge of the materials and techniques, you're gonna limit yourself to what you can do as a dentist. We use the top of the materials, the newest porcelains, the newest bonding agents. It makes a big difference.
What can you fix with veneers? Can you fix the gap between the teeth? Can you fix a missing tooth? What all can be?
Well, you can't fix a missing tooth with veneers, but in between the teeth spacing, what we call a diastema. A lot of people have that where in between the front two teeth there's a gap. That's very easy to fix with veneers.
What about if you have the teeth that are like too small or too big? Can you adjust that?
Oh yeah, some people have the front of their teeth, the edge don't line up. The one edge might be lower than the other. You might have a little chip in one of them. A lot of people have some discolorations in their teeth where some areas are darker than others. You can fix all that with veneers.
Now, what about people that say they fall out?
Oh, I've never had a veneer fall out ever. Any of my veneers that I've ever done have never fallen out. The bonding technique is so strong, it's actually stronger than the tooth itself. The bond of the veneer to the tooth is stronger than the tooth.
Okay, what about I don't notice on you, but I see a lot of people have that little gray line. You've seen that around the edge of the tooth?
Yeah.
What causes that?
That's usually from a crown that has a metal substructure underneath of it.
What is the difference between a crown and a veneer?
A crown fits around the entire tooth. It goes from the front of the tooth, around both sides, and around the entire back, all the way up to the gum line. Now, with the metal fitting crowns where you have a metal substructure underneath there, you don't get any light transmittal through that crown. Any light that comes in and out of your mouth doesn't transmit through the crown. That's why you get that dark line at the top of your tooth, because the root is actually shaded because there's no light transmitting through the tooth. Your gums will get a little bit discolored around the tooth like that where there's no light transmittal. The gums will look a little darker around a tooth that has a metal crown. Some teeth have to have crowns, and other teeth can be cosmetically altered with veneers. If you have a lot of decay in a tooth, or if it's been broken too badly to be fixed with a veneer, then we can use an all ceramic crown, something similar to the material that we use in a veneer, but it goes around the tooth to restore the structure of the tooth a little bit more.
You said just a moment ago that you can actually change somebody's bite. Can you fix it? So if they have trouble chewing or biting, can you fix veneers so that their bite's straight and nice?
Oh, definitely. I've done cases where somebody was looking at having orthodontics done. They didn't want to wear braces for 2 years or go through any other orthodontic process. They wanted something a little bit more immediate. And
how long does it take, by the way, if I decide I want to get veneers?
If you wanted to get veneers, it would take about a 2-week period of time. From one appointment, we prepare the veneers, you leave with temporaries that look just like your permanent veneers are going to look. And then afterwards, you come back about 2 weeks later, we bond the veneers onto your teeth, and you're done. And
what about so when I leave, I still have teeth?
Oh yeah, definitely. Back when I was in dental school and I had my veneers, I had to go around without any temporaries at all.
Do you think there's still dentists that do it that way?
I would imagine so, because the technique making the temporaries is somewhat sensitive as far as, it takes a lot of practice. You have to do a lot of them to get good at making the temporaries.
Is there a learning curve?
Oh, definitely.
Are you better now than you were 12 years ago?
If I was doing the same thing that I was doing 10 years ago, I wouldn't be able to sleep at night.
Really? Is that big a difference?
It is a big difference.
So if somebody decides they want to get veneers, and they go, what should they basically look for in somebody that's going to do them for them? I mean, can all dentists do veneers? Do you have to have a special license?
No, it's general dentistry.
It's not a recognized specialty, is it?
No, cosmetic dentistry, it should be a recognized specialty, but it's not. There's a big learning curve. There's a lot of dentists out there that aren't doing the technique correctly.
Have you ever had to fix anybody's?
Oh, plenty of times. I've had patients that have come in, they just weren't happy with the quality of their veneers. I look at the lab work that was done, and you can tell that they weren't using a good lab. The veneers are very opaque. They don't have any translucency to them. Does the lab
make a big difference?
Oh, definitely. You have to use a good lab. There's plenty of labs out there that have cut rate prices. You don't want to go to a dentist that's using a lab like that. You want to get to somebody that's using a very good lab that has the ability to, I use a local lab here in Phoenix that we're able to send the case and the patient directly to the laboratory for customized shading.
How do you decide what shade? Because I see people that they smile, and I don't know if they're really good at brushing their teeth, or they just have somebody just put in the whitest veneers I've ever seen, and it almost, to me, it looks fake. I mean, can you see a bad veneer job?
Oh,
do you have an eye for it?
Oh, I have such an eye that when somebody comes in with a tooth, I might say, that crown or that veneer really just doesn't match the rest of your teeth, and they might think, oh, it looks fine to me. When I can change that and make a new one that actually matches their smile, they're amazed. They were walking around with that tooth in there that never matched. They didn't notice it, but when you put something in there that is correct and works with the rest of their smile, it makes a big change in their lives.
Right, we have to take a break. I know you brought pictures. I want to see them, the before and afters. And I want to get into some more particulars exactly about what happens when you have veneers put on. Okay. You're watching Medical News Network. I'm Mike Wittgenstein. We'll be right back.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Young, who got some good minutes in the first half, hits the jumper. Tiffany Young, a junior from Hillsboro, Alabama, has 4. Young, 17-footer, got it. And Tiffany Young with a sensational performance.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
You know, parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
Oh, you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community. ConnectForKids.org, guidance for grown-ups.
You're watching Medical News Network. I'm Mike Wittgenstein. In studio today, we have one of Arizona's top cosmetic dentists, Dr. Paul Gebhart, and we're discussing veneers. Before we went to the break, you started to describe to me the difference between a crown and a veneer, but I'm not sure I got the whole answer. What is the difference?
Well, a crown fits around the entire tooth. It covers it up from the top of the gums to the end of the tooth on all surfaces. Goes around it. Everybody pretty much
and a veneer
knows,
doesn't go all the way around the tooth?
No, a veneer just goes on the front of the tooth. We shave down the tooth just a little bit to make room for the veneer, and it gets bonded right in front of the tooth. Just kind of like
a fingernail.
Yeah, kind of like an acrylic fingernail.
And they're strong?
Oh, they're very strong. They're really fragile when you're holding them in your hand. As soon as they get bonded to the tooth, they are very, very strong.
And you can't, well, I honestly can't, done right, you can't tell the, can you straighten teeth? Like teeth that are front, back, maybe a little turn side, can you straighten them?
Oh yeah, definitely. You know, if a tooth is sticking out, we reduce it a little bit more. If a tooth is sitting back, we don't have to reduce it at all. We can just bond the veneer right to the front of the natural tooth. You know, it's great. It's like instant braces.
So what would be a bad veneer job?
A bad veneer job is something that you can tell. Patient walks into the room or into a Christmas party and they smile and you're like, oh my goodness, what?
They got like the big, because I've seen that, the big,
they look like chiclets.
Horse or chiclet?
Yeah.
Little bitty chickens, or those big giant horse teeth?
Yeah.
Is that in the hands of the lab, the dentist, your mouth?
A little bit of both. You know, if the dentist is in control of the lab, he has to do the work. He's ultimately responsible. If he's not using a good lab, he's not going to get good results. So he's got to make sure that he's using a lab that's going to give him the results that he wants. You know, there's so many different types of veneers and so many different.
How much of it is artistry, and how much of it is actual technique when you do veneers?
I would say it's probably about 70% artistry and 30% technique. You know, our technique is most dentists have a fairly good technique as far as being able to shave a tooth down. Shaving it down in the right directions, the right amount of tooth structure being removed, that's where the artistry really takes place.
If somebody goes to get there and they get a little bit, say the dentist removes a little bit too much tooth, or can you fix most problems?
Oh, definitely. If there's too much tooth.
If I have veneers and I'm not happy with them, can you have them redone, or once they're in, you're done?
No, once they're in, they're going to last for 20 years. If you want to have them redone because you don't like the way they look, or you don't think that the dentist that you were seeing had done an adequate job, we can just shave the veneer right back off as if it was your tooth structure. Take you right back down to where the previous dentist had removed it, fix any problems that were made with the preparation technique, and start the case over from scratch at that point.
Okay, what about, say, older people? Maybe get some bad teeth, haven't been able to chew properly in a while. Can you fix those kind of problems with veneers? Oh,
definitely. There's a lot you can do for worn dentition or worn teeth. A lot of times it gets a little bit more comprehensive of treatment. We have to build up the back teeth a little bit to open your bite a little bit. But once we open your bite and we have some space to work with in the front, then we can put either veneers or all porcelain crowns. But most likely veneers would work just fine. Restore the teeth so that you actually have a nice smile line where it's supposed to be, rather than too high up underneath your lip. You know, a lot of people you see, they'll walk into a room and they won't smile, they'll cover up their mouth, or when they do smile, you really don't see a whole lot of teeth. It's because their front teeth are worn down. and we can restore all that with veneers.
Where you get that like little yellow line across the tooth?
Yeah, that's very common in the elderly population. The teeth wear over time. The incisal edge, or the edge of the tooth, wears down. There's no more enamel on the tooth. So you start to see that dark yellow line across the top of the teeth. That is basically the inner surface of the tooth, the dentin inside the tooth.
What about, is there a minimum number you have to do? Like if I had one tooth, do you have to do 10, or can you do 1?
It depends on what you're really looking for. If maybe you've had a root canal done on one of your front teeth and the tooth is dark.
I've seen that, where like just one tooth. Is that what it is, a root canal, where they've done that?
Usually a tooth that darkens is from the nerve has died on the tooth. Whether it's had a root canal or not, maybe the tooth was bumped when you were 10 years old riding your bike. That tooth can darken up over time. One single veneer can fix that. If you're looking for a real smile makeover and you want to have all these other problems that may be, the length of the teeth, the width of the teeth, spacing in between the teeth, discoloration.
You said you can close that gap in the front?
Yeah, that's very easy to fix. The spacing between the teeth, all that can be restored. I usually like to have somebody that really wants a nice smile makeover to have a minimum of 8 veneers done. That way we can round the corner of the mouth so that when you smile, you get that nice big white broad smile.
But you can use veneers to repair single teeth if that's what it
definitely,
takes?
Yeah.
Now, do you use veneers in conjunction with anything else? Can you?
A lot of times patients come in, they may be missing a front tooth, they may be missing something on the side, they have some crowns that have already been done, but they want to have a whole smile makeover. Then you'll intersperse a couple of veneers, a crown, a bridge, all encompassing the smile makeover.
What about pain? Do they hurt?
No.
I mean, can't we?
Everything in dentistry has a little bit of, maybe a little discomfort here and there, but we do everything in our ability to reduce the amount of discomfort that you may have. But veneers don't hurt at all.
Does your office practice sedation dentistry, pain-free dentistry?
Yeah, we do. We offer sedation dentistry, nitrous oxide gas. We also do some oral conscious sedation where we give you some medication orally, put you into la-la land basically.
And then you get them done. Wake up and they're done.
You're in the chair for an hour.
Are they hard
or so.
to learn to use once you have them? Does it change your speech? I mean, can it change your speech? I've seen people whose speech changes after they get the veneers put in.
Well, generally for a little bit of time afterwards, you have to get used to them. When I had my veneers done, I smiled and I said, that didn't look like me. But a week or so later, I got used to the way they looked, and I saw such an improvement. Your lip
Give you a little more self-confidence?
A lot. I had always been ridiculed when I was a kid. Oh, he's got buck teeth and things like that. And I had the orthodontics done, and that straightened them out, but I still just wasn't happy with the way they looked. They were brown, and they were misshapen. They were just too straight, and just looked funny. So when I had the ability to get them veneers done, it made a huge impact on my life. I could smile. I was a dentist. I wanted to be able to portray dental health, and I couldn't do that with the way that my smile looked before.
Now, if you have, you address the gums when you do the veneers?
Mm-hmm.
You clean if there's any disease, and do you think it's physically better for your health if your mouth's in good shape?
Oh my goodness, the correlation between heart attack and stroke and periodontal or gum disease is been shown repeatedly over the last 2 years. They're saying that actually gum disease is a better causative factor of heart attack or stroke than high cholesterol levels.
Now, if you have, if I have some bad teeth and I have a little bit of gum disease, if I take the time, I put the veneers in and clean it up, will that help?
Oh, definitely. If you have any decay in your teeth, we can fix that decay while we're doing the veneers. You end up with a really nice smooth surface right at the gum line. What do your gums like? They like smooth. They don't like rough, jagged edges. They don't want ledges. They want nice, smooth edges.
We have to take another break.
Okay.
I hate to cut you off, and I do want to see your pictures. So when we come back, we're going to look at your before and afters, and we're going to a few more particulars about exactly what veneers are. You're watching Medical News Network. I'm Mike Wittgenstein. We'll be right back.
Hi, I'm Christina, and I'm way into basketball.
My name is Salima, and I am definitely into discovery.
My name is Demisha.
And my name is Tramel.
Action. We love making movies. And we're all into the Boys and Girls Club.
Gila River Casinos, building communities where everyone's a winner.
Why would anybody give someone they don't know a gift? They do it because this gift saves lives. And the need for it is desperate. We need over 20,000 people to give this precious gift every day. Please give blood. There's a life to be saved right now. Call the American Red Cross at 1-800-GIVE-LIFE.
You're watching Medical News Network. I'm Mike Wittgenstein. In studio today, we have one of Arizona's top cosmetic dentists, Dr. Paul Gebhart. Now, Paul, patients, are they mostly male or female?
Well, it used to be that they were mostly female, but now more and more men and female are getting veneers done. It's just a
Are
real
the patients older, or are they becoming older and older, younger and younger? But, how old's the average patient?
It's mostly, your 35 to 45-year-old baby boomers, but we're doing veneers on everybody nowadays.
Do you think a lot of people do it for their careers or for other reasons?
Your smile portrays a lot about you. When people walk up to you, the first thing you notice about them is their smile. It makes you welcoming and inviting. People want to look at somebody that has a nice smile. If you're at a restaurant and your waiter comes up and he has got a really bad smile, he's got a missing tooth or he's got cracks, you just get a visual thing about it,
Right. Yeah. No, I will tell you, that's a big deal to me. If the waiter or waitress, anybody that's in a customer service position that I'm dealing with, if they have bad teeth, and I don't mean to, but subconsciously, if they have bad teeth, they're not quite.
Perception. Everybody's perception is that somebody with a really nice smile is smarter, is cleaner, is done. You go on.
Let's take a look at some. Tell me about the first one here.
This is my first patient. She.
Well, that looks like a nice smile. It's pretty nice.
She's about 50 years old, and she's had some cracks in her front teeth. She has a crown that really fit very well. The porcelain quality was poor. It was incisal edge there.
Is she missing a tooth on the right there?
Yeah, she is missing one tooth, and she has some silver fillings in the back that show when she smiles.
So what did you do for her?
I ended up doing about working on 10 teeth here. I did a 3-unit bridge to replace the missing tooth. I did a crown to replace an all porcelain crown to replace the crown that was there, and then I also did 5 veneers in the area.
Okay. Now she comes in. You look at her, you decide what you're going to do. And then you brought a picture of her with her temporaries, right?
With her temporaries. This shows how she left. You can see that the edges are all more even.
Now, is this pretty much what her regular teeth are going to look like?
Yeah, to a certain extent. We were able to mimic the final product in the temporaries.
So she knows when she leaves basically what it's going to look like when it's done.
Yeah, I usually give the patient about 2 days of what they're wearing their temporaries. So if there's any alterations, something that maybe they want one tooth a little bit longer than the temporaries, or the shade. If the shade of the temporaries is a little bit too light or a little bit too dark, we can make those alterations before I send it to the laboratory.
So they actually get to wear and see what it's going to look like, and any changes they want to make, they can do at that point in time before the final veneers are made. All right, well, let's take a look at her after picture.
This is her after picture.
Wow, it's a big difference.
Yeah, you can see that the incisal edges are all lining up. The teeth are all the same color.
And it took you 2
looks
weeks.
Completely natural. 2-week period of time.
That's incredible.
This is a 49-year-old man. He came to me, he just wasn't happy with the way his smile looked. He had a lot of old restorations in the front teeth that have kind of yellowed and aged, and they've gotten quite brown. Also, he has his incisal edges, or the edge of his teeth, is very straight across, and it kind of aged him. It made him look a little older than he really is.
And what did you do for him?
Well, I did 8 veneers on him, all the way from one side to the other. Got a nice, even look. We altered the incisal, or the edges of the teeth a little bit, gave him a little bit of curve to it, so it made him look a little younger. Also evened out the fronts of the teeth. His teeth before had quite a bit of, one tooth was sitting out, one tooth was sitting back. We were able to even that all out.
All right, let's take a look at his after. Wow, that is a big difference.
Yeah. You know, you can see, that, once again, got a nice even look. You can see the color is very even. All the splotchiness that was there before.
He almost looks like he's better educated.
You know,
I mean, it makes a giant difference in how his appearance. I hate to say that, but
and he's even said that it just makes him feel so much better about himself.
Do you think a lot of this is being driven by the TV shows, the makeover, the extreme makeover shows on TV?
Oh, definitely. It's a craze right now. There's so many people.
I'm going to put you on the spot. What do you think about some of those?
Well, most of the time when myself and my colleagues get together, we'll look at a case like that and we see the person walks out, they've just gotten 10 veneers done, and everybody's clapping and they look great. But we look at the teeth and we're like, that just doesn't look natural. They look like horse teeth sometimes. And I'm sure that most people out there are saying the same thing.
It is. I will tell you, I watch it and I'm not always impressed by the work they do.
And I think a lot of times they just, the artistry's not there. They're doing a great job of marketing, but you have to make the tooth look natural when you're done.
So somebody sitting at home right now watching the show, listening to what you have to say, what do you want them to know about veneers in particular and about iSmile Dental? I did a little research on iSmile. I realized they're growing like crazy in Arizona. So what do you want everybody to know about them?
Well, veneers much easier than you would expect. Affordable for everybody. There's no reason if you're walking around out there, you're not happy with your smile, not to look into it at least.
And they can change your life?
Definitely.
What about people that have questions, concerns, maybe don't know what to do? Is there somewhere they can go? I mean, can they call you?
Yeah, they can call me. I'm always accessible. I want to be part of changing people's lives, and this is a great way to do it.
And what about iSmile Dental?
iSmile, we're a growing group of offices in the Phoenix area. We have an office over in Arrowhead Mall, one of the first dental offices in a mall. And we have everything available there. You can come in. If you come with somebody, we'll give you a pager. You can go shopping around at the mall for a little while. We'll buzz you when we're done. State-of-the-art facility, digital radiography, and it's a wonderful place.
Do you have the TVs?
Yeah. All the rooms have ceiling TVs.
So when I'm laying, I can watch the show?
Yep, hooked up to Dish Network. So.
All right, I want to thank you for coming in. You've been very informative. Welcome. You've been watching Medical News Network. I'm Mike Wittgenstein. For further information on this topic or any other, please visit our website at medicalnewsnetwork.info. Until next time, take care.